Hello. As a veterinary dental specialist, I spend a great deal of my time dealing with periodontal disease in pet dogs and cats. Some of that time is spent trying to explain the disease process to pet owners. And it occurs to me that while I'm very familiar with the terminology that I'm using, having done nothing but dental and oral surgery for the last 30 or so years, many of the pet owners that I'm speaking to may find some of these terms unfamiliar and somewhat baffling. So I would like to use this video to introduce periodontal anatomy and terminology, and we'll also go through a little bit of the progression of periodontal disease, what happens below the surface as we go from the healthy situation through to advanced periodontal disease. The term periodontal disease refers to a group of conditions that affect the periodontal tissues, and those tissues are the gum tissue, or gingiva, the alveolar bone, which is the bone of the jaws in which the roots of the teeth reside, the periodontal ligament, which is the soft tissue that goes from the bone on one side to the root on the other side of the space, and cementum, which is the covering on the root surface of the tooth into which the periodontal ligament fibers are embedded. So the four periodontal tissues are gingiva, alveolar bone, periodontal ligament, and cementum. And periodontal disease is that group of diseases that affects those four tissues. In general, we're referring to bacterially induced inflammation that causes progressive destruction of those four tissues. Destruction of the gum tissue, the periodontal ligament, the alveolar bone, and the cementum. I'll start by describing the normal anatomy of the periodontal tissues, the tooth and the surrounding structures, and then we'll look at progression of periodontal disease. But I need to make it abundantly clear that this is an extreme oversimplification of a very complex group of tissues and a very complex disease process. So this is very introductory for pet owners who maybe have never heard these terms before. But it is by no means a comprehensive discussion of periodontal disease. So here is a cartoon cross-section through a hypothetical tooth, with some proportions being exaggerated for the purposes of illustration. The crown of the tooth is covered by a thin layer of enamel. The root is covered by cementum. And where those two tissues meet is the cemento-enamel junction. So that's the junction between the root and the crown of the tooth. Most of the root is embedded in bone, and there's space between the root and the bone that contains the periodontal ligament that holds the tooth in place and acts as a bit of a shock absorber for it. Underneath the cementum of the root and the enamel of the crown, the hard tissue that makes up most of the tooth is dentin, and then inside all of that is the hollow space that contains the blood vessels, nerves, and other soft tissue, the dental pulp. Normally, the only way in or out of the pulp chamber is through a collection of tiny little channels at the tip of the root, but that's not really important to our discussion about periodontal disease. Most of the mouth is lined by fairly thin, delicate, soft tissue called oral mucosa. And higher up we have a band of much thicker, tougher gum tissue, or gingiva, and where those two tissues meet, that's the mucogingival junction. In the healthy situation, the gingiva is firmly attached to the bone up to the top of the socket, and then part of the root is outside of the socket, so the gingiva should be firmly attached to the cementum, wrapping all the way around the tooth, around its entire circumference. And it's the connection of the gingiva to the cementum that is the physical barrier against bacteria getting underneath the gum line and up into the space between the root and the bone. So it's the gingival attachment to cementum, that's the physical barrier against periodontal disease. The portion of the gum tissue that's attached to the bone and the cementum, that's known as the attached gingiva, but then you'll see that the gingiva comes up above the cemento-enamel junction a little bit and lies against the enamel. So that's the unattached gingiva, or the free gingiva. Now, the free gingiva doesn't physically attach to the enamel, it just lies passively against it. when it's very healthy, it's firmly braced and held tightly against the enamel. But there's still a potential space between the enamel and the gingiva, and that space is known as the gingival sulcus. We have this around our teeth as well. When we go to the dentist, they'll stick an instrument up underneath our gum line and measure the depth of that space. They're measuring what's known as probing depth. And the depth allowable for the gingival sulcus depends on the size of the tooth and the size of the patient, but the probe should not go beyond the cemento-enamel junction in the healthy situation. I want to take a detour for a few moments. We were just talking about the gingival sulcus and how probing depth will vary depending on the size of the patient and the size of the tooth. I have a paper on my website that discusses this in more detail, and I want to show you how you would navigate to find that paper, and it'll be on that same page that you'll find a number of other papers on a wide range of topics regarding dental and oral health in dogs and cats. So to find these resources, which are available to veterinarians and pet owners alike, they're basically available to anybody with internet access, you would start off by going to www.toothvet.ca. That's my website. And here's the landing page that takes you to. If you then click on the dog or cat's teeth, that takes you into this next page. And you can see here we've got at the top a number of buttons, each one taking you to a different page on my website. But the one in particular we're looking for right now is the old cusp articles page. So you would click on that, and that takes you to this page where I have posted PDF versions of a number of papers that I've written over the years and self-published on a variety of topics regarding veterinary dentistry. We're talking about periodontal disease, and the section on periodontal disease is near the top of the paper, or near the top of the page. And partway through that section on periodontal disease, you will see the title on the left for probing depth. And if you click on that link, it takes you to that paper on probing depth. At the end of this video, I'm going to mention a number of other papers that you might want to review for more background, more information, more detail on the subjects we've been discussing. And this is how you're going to find them. You're going to go to toothvet.ca, and on that home page, when you land on that home page, you click on the teeth, click on old cusp articles, and there you are with all those links available for you anytime for you to share with your clients and your colleagues, or to use them as you will. You'll note that as the enamel gets closer to the cemento-enamel junction, it gets thinner, and that creates a little bit of an overhang. And the way the gingiva lies against the tooth, it tapers to a nice knife-sharp edge so that it kind of tucks in underneath that overhang. And so what that means is that while the animal's chewing on things, any debris or anything mechanical coming down the crown of the tooth is deflected away from the gingival sulcus, not into it. And that anatomy is part of the protective mechanism to keep debris from getting jammed in underneath the gum line. This is a photograph of the right side of a dog's mouth, a clean, healthy mouth with good, healthy gingiva. And so in this we see the free gingival margin where the gingiva ends and the tooth becomes visible. And then this line up here, that's the mucogingival junction. So you can see that over the canine teeth, or the large fang teeth here, the gingiva is much wider than it is further back in the mouth over the premolar teeth, where we have far less gingiva between the free gingival margin and the mucogingival junction. This is an intraoral dental radiograph of a dog's right lower jaw, and in the middle of the picture we're looking at the lower first molar. And so I'm going to highlight the radiographic features, the anatomic features as we see them on X-ray. So this dark line going around the root, that's the periodontal ligament space, the space between the root and the alveolar bone, the space that contains the periodontal ligament. And on the crown of the tooth we can see the very white enamel covering the crown. and that ends there and there. And so that's the cemento-enamel junction. And that means that this space here, that amount of root structure, is where the gingiva attaches to the root above the level of the bone and below the cemento-enamel junction. So that's where we have our physical barrier against periodontal disease. And then we can see the hollow space inside the tooth, the pulp chamber, where the blood vessels and nerves and other soft tissue inside the tooth reside. Here we are back at the drawing the cross-section through the tooth, and I'm just going to zoom in on the area where the battleground for periodontal disease. So, the development of periodontal disease goes like this. We start off with an accumulation of plaque on the crown surface. Now, if we have a good plaque control program, if it's a mechanical program, then that plaque, when it accumulates, it's then removed by whatever mechanical means, brushing the teeth or whatever. And then between cleanings, between brushings, it accumulates and we remove it and accumulates and remove it. But it never has a chance to accumulate to a degree that's going to cause disease. But if it's left undisturbed, then it grows thicker and accumulates more of the harmful bacteria and may start to accumulate the minerals that help to the tartar that helps to hold it on the tooth surface so that it can't be removed by the simple mechanical means. And the bacteria in the plaque right next to the gingiva releases toxins, and those toxins cause inflammation. And that inflammation, among the things that it does, is it causes breakdown of the collagen, which is the main structural protein that makes the gingiva tough and firm. And so now it becomes somewhat flabby and loose, starts to fall away from the tooth surface and becomes rounder in contour. So unlike the healthy situation we have over on the left side, why is it not drawing there, where the gingiva is firmly braced against the tooth, over here on the right side it's starting to fall away. And so that allows the plaque to propagate further up the tooth down below the gum line. And now any mechanical means of plaque control that work on the visible part of the tooth can clean the crown, but can't get below the gum line to remove that subgingival plaque. And that's going to mean that we're going to have persistence of the gingivitis even in the face of brushing the teeth or giving a dental treat or diet or whatever. So it's at this phase that we've gone past the point of prevention. There's disease. And so now it's time to get the animal under anesthetic for a detailed examination and to clean below the gum line to remove those subgingival plaque deposits and create an environment that will hopefully allow that gingiva to heal, the collagen to regenerate, and create that nice, firm, well-toned gingiva tucked tightly up against the tooth. So return that area to its normal, healthy state. But if that's not done, if the gingivitis is left untreated and the plaque is allowed to persist below the gum line, then the gingiva will remain inflamed and the plaque will continue to persist below the gum line, causing further inflammation. And that inflammation will start then to break down the gingival attachment. So remembering that the gingiva was firmly attached to the cementum above the tooth socket, the plaque below the gum line will start to cause that gingiva to detach from the root. And so now we don't just have a gingival sulcus. This is the formation of a periodontal pocket, where now the gingiva is not attached at the cemento-enamel junction. And so if we were to take a probe and go below the gum line, it would go well past the cemento-enamel junction and down to the bottom of this periodontal pocket. Now at this phase that I've drawn here, the gum line is still where it was, the level of the bone is still where it was. There's no loss of tissue at this point. So if we get at this tooth at this stage and get up underneath there and remove the plaque and mineral deposits from this fairly shallow periodontal pocket and remove the inflamed soft tissue on the lining of the pocket, then that allows for the gingiva to reattach and to regain its health and for things to get back to the normal state. So that is still a reversible phase or a reversible stage of periodontal disease. But if treatment isn't undertaken at that stage, then we will end up with a worsening of the problem. And it's at this stage that things can take a few different turns. But let's for now draw our deposits of plaque and calculus on the root above the bone, and we've still got our periodontal pocket and gingiva, but the gingiva is still attached to the bone, and we haven't lost any bone yet. But with persistent inflammation below the gum line, that will then start to cause the bone to be resorbed by the inflammatory process. And as this is going on, we may also start to get loss of the gum tissue. So it might start to recess or recede. Now the mucogingival junction, which is right there, it's not going to move. So it's not like the gum is migrating up the tooth. We're actually losing gum tissue during this process of gingival recession. And once we get to a certain point, once the gingiva is gone, it's gone forever. So at this stage of periodontal disease, we've got plaque and calculus below the gum line and an ever-deepening pocket of periodontal infection and tissue destruction. So now we may have, regardless of where the gingival line is, we now have a pocket that goes down well below the gum line with significant bone loss. And at this stage, if we were to treat this animal and get in there and remove all these deposits from the root surface and remove the inflamed soft tissue from the lining of the pocket, then it's possible that we may get the gingiva to lie against the tooth again. And reattach, but the bone loss is probably going to be permanent. We're not likely to get that bone growing back, and the gingival recession will likely be permanent. So where the gum line used to be up here, it's now down here. So now we have some of the root exposed above the surface, and it's a rougher, more porous surface. It's a harder surface to keep clean. So we're going to get more plaque accumulation there more rapidly than if we were able to keep the gum up above the gum line. So although in this diagram the tooth has responded to periodontal treatment here, the tissues have sort of healed back onto the tooth and the pocket is now being eradicated, we've got permanent bone loss, permanent gingival recession, and so that area is not back to normal. It's not as healthy as it once was before periodontal disease began, but at least we've halted the progression of disease and made things healthier than they were. Now, if treatment isn't undertaken at that phase, then we just get further progression of the problem with more gingival recession and more bone loss, and to the point where there may be so much tissue destruction that we've lost all of the gingiva or most of it, and we have a deep pocket with infection going deep below the gum line, well up the root. And once we get periodontal disease extending a significant distance up the root, then usually at that point the only way to alleviate the situation, to rid the the mouth of the pain and infection associated with this is to extract the tooth. Previously, we were looking at a cross-section through the single root of a tooth, or through a single rooted tooth. Here we're seeing a side view of a two-rooted tooth. And so now we have a new anatomic feature we didn't discuss previously, and that's the spot where the two roots separate from the crown and go in their own separate directions. And that location is known as a frication, which comes from the Latin root for fork. And that adds another layer of complexity to the management of periodontal disease. So as we were looking at earlier, when we get periodontal disease working its way up underneath the gum line over one flat surface, we can get the development of a periodontal pocket. We can get bone loss and or gingival recession, and the formation of a periodontal pocket up underneath the gum line. And in that instance, it might be manageable by getting down below the gum line to physically remove the deposits from the root of the surface of the tooth, from the surface of the root of the tooth, get rid of the plaque and calculus down there, and get rid of the inflamed soft tissue lying on the inside wall of the pocket, so that we then have a clean root surface on one side and fresh bleeding connective tissue on the other side. And if we can get that, then we can get the gum to potentially reattach itself to the cementum so that we eradicate the periodontal pocket. The bone loss is going to be relatively, or in most cases it's going to be permanent, but at least if the gum can reattach, we can get rid of the pocket, we can prevent progression of disease and return that area of the tooth back to health. But if the process is working its way up underneath the gum line over the side wall of the tooth and getting into the frication, causing loss of connection of the gingiva and the periodontal ligament and bone loss below the surface into the frication, that can be a much more challenging area to get into surgically to thoroughly remove all of the deposits and all of the inflamed soft tissue and create an environment that's conducive to healing. So when we have periodontal disease into the frication, it really dramatically reduces the prognosis for that tooth, or the likelihood that we're going to be able to halt the progression of disease and bring that tooth back to a healthy state. And so once we have frication exposure, it's much more likely that the only reasonable option for that tooth is for it to be extracted. That's my rather simplistic explanation of periodontal anatomy and the progression of periodontal disease. As I mentioned, there are a number of papers on my website that add more detail to these topics. So let's go have a look at how you would find those. So to find those resources, just to review, you start off by going to toothvet.ca, which takes you to this page. When you get there, you can click on the teeth, click on Old Cusp Articles page, and because we're talking about periodontal disease, you could click on that, and that will take you to this section. And here we have a paper on the anatomy and physiology of the periodontium, which goes into more detail than I have in this video. A paper on why periodontal disease is still so common. And this is a really important one regarding the hidden nature of periodontal disease and how virtually impossible it is to evaluate an animal's periodontal health on conscious examination. We really need to have them under general anesthetic to radiograph and examine below the gum line to get a fuller picture of the true extent of disease. And there are some other videos on my YouTube channel that relate to that. For instance, this one on intraoral dental radiography, why is it essential? Now that's a 42-minute lecture aimed particularly at veterinarians, but certainly pet owners are welcome to view it as well if they're interested. These resources on the Old Cusp Articles page, these papers, they're PDFs, and you're certainly welcome to share them with your clients and colleagues and friends and family and whatever. I would just ask that when you do so, credit where it's due, leave the papers intact so they appear as the originals with authorship clearly indicated on the pages. In the next video, I will plan to talk about how we treat periodontal disease when it has occurred and what owners can do to try and prevent progression of disease, or if we're proactive enough, hopefully prevent disease from developing in the first place. That concludes this video on periodontal anatomy and progression of periodontal disease. I hope you found it informative. Thank you very much for watching. Goodbye.